Hundreds of full-time private hospital consultants say further negotiations are needed before they'll sign an HSE contract enabling them to treat public patients during the COVID-19 crisis. The Irish Hospital Consultants Association says the terms of a draft agreement could force the closure of their members' consulting rooms.
Stephen Fröhlich is a full-time private practice intensive care consultant. He is among 600 private consultants who haven't signed an HSE contract because it doesn't cover their running costs, which could exceed their income.
In effect, it's like leasing an aeroplane. They've taken the aeroplane, but they don't have the pilots with it. So that it doesn't enable the hospitals to function as they normally would. There are other patients I know of, whom a colleague was treating, who were due for diagnostic procedures to stage their prostate cancer. They had to be cancelled. And remember, these are patients who, in many cases for decades, have been paying their health insurance.
In a statement this evening, the Irish Hospital Consultants Association said an agreement had been reached last Thursday, which would allow their members to see their existing patients and new referrals necessitated by the COVID-19 emergency to be cared for on an agreed basis, including the continued operation of consulting rooms. But it said this did not materialise in the written contract circulated on Friday. So where does this leave the 2 million people with private health insurance? Financial support measures are expected to be announced by insurance companies later this week.
This is a very hard one to call because what people don't realise is claims are still coming in. So for private paediatrics, private maternity, private mental health services, addiction services, even the charges in the public hospitals, those claims are still going to come in.
The State Claims Agency will provide indemnity to these consultants until next Sunday to allow time to resolve the issues. In the meantime, the consultants say they will continue to see their patients in the same setting, but for free, because they are now considered public patients. Diane Connor, RTE News.